Good morning, everyone. My name is Kim. I am the Children and Young Adult Consultant with the Connecticut State Library. And welcome to Growing Equitable Library Services, preparing library staff to assist people experiencing homelessness. I'm here with I am here with Ashley Sklar. She is our Adult Services Consultant up at the Connecticut State Library Division of Library Development. And thank you for being with us this morning. We are going to turn it right over to Amber and Diana. They are here with us today from CCEH, the Connecticut Coalition to End Homelessness, and you guys are in for a fantastic presentation. Thank you, Amber and Diana, for being with us here today. We are really interested in what you have to share with us, and we are ready to listen and learn with you. Thank you.
All right, great. Thank you so much, Kim and Ashley, for having us here. As I said, this is our training that we're going to do today on growing equitable library practices, library services, preparing library staff to assist people experiencing homelessness. So because this is a webinar, you all are actually all muted, but you can type any questions that you have inside the questions box at any time, and we'll be sure to get to your questions. Also, this is being recorded, so the recording, the slides will be available for you all after the training. So I am Amber Freeman. I am the Interim Director of Technical Assistance and Capacity Building here at the Connecticut Coalition to End Homelessness. So I oversee all of our programs that we do. So all of our work that is directed towards youth and families. We have a reentry program, we have emergency services. What else? We have race equity work, a large sum of programs. And we also have Diana Berube, who is our program manager for prevention and exit strategies. And Diana takes the lead on our shelter diversion and rapid exit practices. And she will actually be taking the lead on this training because this fits right up in her alley as far as the expertise she has in this area. But I'm going to just start us off really just first starting with, we are really excited about this partnership that we have now with the Connecticut State Libraries. It is fair, kind of overdue, right? We look at the libraries as being such an ally to our homeless response system. And it's really important for us to have this training because as people experience poverty and homelessness, it really impacts everyone. And then the large amount of the people that are experiencing poverty and homelessness, they often go to the library. I'm sure you all realize that that population go to your library pretty frequently, and it provides you all with the opportunity to really change lives, right? So as the number of children, adults, and families in America, as that number continues to rise of those that are experiencing a housing crisis, unfortunately, so does the urgent need for libraries to effectively respond to their needs. So today we're going to provide you with some tips and resources to help you be able to respond to those needs in a better capacity. Also, libraries have access to information and resources and services and technology that individuals use all the time. And it's really especially important for those that are experiencing some type of crisis, those that are going through economical disadvantages, those who may be experiencing isolation, discrimination and prejudice or other barriers to education, employment, and housing. So they really go to the library as a place of refuge and safe haven to really access those resources and supports. So we have a lot of information that we're going to go over with you all today, but before we actually start, I kind of just want to go over who we are at the Connecticut Coalition to End Homelessness, just so you can have an understanding of why we're doing this training today. So CCEH was founded in 1982 to provide a voice for the nonprofit organizations, faith-based groups, and municipal governments responding to the then emerging crisis of homelessness. So Connecticut Coalition to End Homelessness is the leading statewide organization supporting efforts to end homelessness. Our mission is very, very simple. In summary, our overall mission is to prevent and end homelessness in Connecticut. That's it, plain and simple. We want to prevent and end homelessness. And our vision is to have a statewide system that's capable of ensuring that homelessness is rare, brief, and non-recurring. All the work that we do is really based off of those three things. We are big on providing prevention and diversion, which is why we're doing this training today, because we don't want anyone to fall into the homeless system. But if someone does, we want it to be very, very short, very brief, and only happen one time, right? Not having repeated episodes of homelessness. So CCEH, we work off of 5 main groups. Our first one is data and analysis, where we administer statewide data system. On homelessness, we oversee the Homeless Management Information System. We conduct data analysis and research to inform and influence practice, policy, and funding decisions related to end homelessness. We also provide training and technical assistance, which we are doing today. So we're working with our providers as well as other community partners to help them build capacity, share, learn, and implement best practices. We also work in the area of advocacy, where we're educating elected officials, the public, other partners about what the problem is, what the solutions are, and the resources that we truly need to end homelessness. We also work within community impact, which strengthens our local collaboration, creates and supports adherence to policies and procedures, provides staff support in communities, and ensures quality as well as equitable work. Also, our emergency financial assistance area is where we raise money to fill the gaps in emergency resources that frontline workers can access to help individuals and families facing homelessness transition quickly from homelessness to housing. So that was a very fast overview of what we do here at CCEH. And we have a lot of information to go over with you all today, so I'm going to try to be very mindful about our time as well as give you all this information that we have. So our agenda today consists of, we're going to start off going over in full detail our homeless response system that we have in place in Connecticut. We're also going to speak specifically to libraries and you all, how you interact with people that are experiencing homelessness. We're going to go over some best practices that we use within our homeless response system that can be beneficial for you all to adapt in the Connecticut State Library. We're also going to talk about the basics of shelter diversion and how to do effective shelter diversion, resource mapping, and then we'll finish out with some scenarios and questions and answers. So at this point, I am going to hand it over to Diana to talk about our Connecticut Coordinated Access Network.
Thank you, Amber, and thank you all for joining us this morning. So we're going to go over, as Amber stated in the agenda, the Connecticut Homeless Response System as a whole. So we'll start off by explaining what the Coordinated Access Network means, and we call those CANs. So when we speak about the CAN system, we're referring to Coordinated Access Network. So our state of Connecticut is broken down into 7 regions. Within those 7 regions, our providers, so those are emergency shelter providers, outreach workers, other community partners, all work within their own specific region, but again, as a statewide system in Connecticut as a whole. So our regions are broken up so that local providers can meet on a regular basis to discuss how the system is working, tweak our system to make changes more effective, to really work with those individuals that we've identified within each region as experiencing homelessness to, again, make sure that those episodes of homelessness are, as Amber stated, rare, brief, and non-recurring. So the 7 regions in the state of Connecticut are Fairfield County, Greater New Haven, Meriden, Middlesex, and Wallingford, the Waterbury Litchfield, which is now actually called the Northwest CAN, Central can in the middle of the state, Greater Hartford can, and the right side yellow region, the larger region, is the Eastern can. The providers within these regions can be useful to you at your local library to know which can you would be located in and what your community partners are within that region to assist folks that are experiencing homelessness. And I think, yeah, thank you. Okay, so this slide I'm going to spend a little bit of time on. It really gives a full flow chart of our Connecticut homeless response system. This is our CAN system overview. So we have one hotline that anybody statewide can call that's experiencing a housing crisis in order to get connected to appropriate services to help them resolve their crisis as quickly as possible. So this flow chart kind of gives from the initial call to 211, which is our statewide hotline, to anywhere from needing an emergency shelter stay, getting connected to an outreach worker. So I'll kind of go through the steps of this flow chart for you to give you a better understanding of kind of the client experience from the moment that a housing crisis has been identified to the call to 211, and as they kind of go through our system, what the steps are. So anyone can call 211, whether you're an individual or a family household. The head of household should be calling in that instance. The initial call to 211 is handled by our United Way call center that's located in Rocky Hill, Connecticut. They are staffed by call specialists who take the initial call. Again, 211 is a resource for many services across the state. People can call to access, how to apply for SNAP benefits, if they need crisis intervention because somebody's exhibiting suicidal ideation. But we're focusing now for this 211 call on that population that's calling specifically for housing related services. So the initial call to 211 gets picked up by a call specialist who will spend about 5 to 10 minutes on the phone with the client to try to work through an initial kind of problem-solving conversation to see if there are other resources available, maybe friends or natural supports that family members that somebody might be able to stay with if they don't have a place to stay of their own, kind of working through that quick conversation to see if there are some easy solutions that can be identified and ways to resolve a housing crisis quickly. If the phone call is not successful in identifying a diversion plan, so diverting somebody from experiencing an emergency shelter stay or a literal homelessness out on the street, we want to prevent that at all costs. So if that initial conversation is not fruitful, the client or the person experiencing homelessness will be set up with a more in-depth appointment with the provider within their region. So going back to that map that we just showed of the 7 regions across the state of Connecticut, the person experiencing homelessness will be set up with a phone call, which during COVID times, all of our assessments are done by phone initially, whereas in the past it would have been an in-person interview that they would go to. But again, those are set up region specific so that the providers within the region know their own closely knit resources and can work through, again, a further in-depth problem-solving conversation, be able to provide the household with other resources in the region, and the goal is to resolve the housing crisis at that appointment. So that's that. Could be up to an hour, full conversation to discuss the specifics of the housing crisis, what barriers the household is facing, and to come up with some resolutions. If, again, after that more in-depth conversation has been had and diversion from homelessness is not possible, there are a couple of things that might happen. If the individual or household has found themselves sleeping outside or on the street or in what we call within our system a place not meant for human habitation, they may be placed on a wait list for emergency shelter. More often than not, our emergency shelters are at capacity, especially during COVID times where we're trying to keep congregate settings of people as limited as possible. So a limited number of beds that are most often full. We do have to run how we run wait lists, and I'll go into a little bit more specifics of that. So you might be placed on a list awaiting a shelter bed, or you may be at that point connected to an outreach worker, somebody that can come out and meet with people out in the community, which is where you library folks might come in handy in working with our system to make sure that you have communication with local outreach providers and staff, so that folks that are in and out of your library system might make sure that we remain connected. So at that CAN appointment, diversion's not happening. We know that an episode of homelessness is either happening now or it's imminent within the next few days. They will go on the list for shelter and be connected with an outreach worker. At that point, whether a household enters emergency shelter or is working closely with an outreach provider, we do what we call conduct a VI SPDAT. It's basically a survey that assesses for vulnerability. So someone who might be elderly, has poor health, is accessing other emergency services like the judicial system or the hospitals, would score a little bit higher, and we would know that that household is in need of more intense services. So once that survey is conducted, whether that be by an emergency shelter provider or an outreach worker, having that survey done enables us to put that household on what we call a by name list. So as you work through the flow chart, that last big rectangle there, that by name list, is a full functioning list of the folks that we have identified across the state of Connecticut, and we break them down region specific by each of those 7 cans, to identify those folks that are in need of housing intervention. By being on that by name list, folks can access some financial services, some case management. The financial services can range from a one-time service, just one bump to get people on their feet quickly, to anything to a full, very intense case management, rental assistance for a long stretch of time, based on the household's level of housing crisis and their vulnerability as deemed by the VI SPDAT. Each of our 7 regions, again, review their by name list bi-monthly, and they get together in what we call housing solutions meetings, where they review what openings they may have for housing interventions, reviewing the folks that are on that by name list and matching folks to housing resources to help them resolve their crisis quickly. So I want to talk a little bit about the coordinated assessment, and we give this analogy of treating the initial coordinated assessment. So thinking about that first 211 call that's picked up by a call specialist, and then the second step in the homeless response system of that CAN assessment, which again used to be in person and now is up to about an hour-long conversation on the phone. So we liken it to someone walking into an emergency room, right? So you might go to the emergency room because you're facing a health crisis that could be anywhere from a sprained ankle to someone having chest pains and maybe having a heart attack. And the emergency room staff will have to triage that person walking in to identify the level of crisis and how quickly they need to be seen by a doctor, and get them to the services that they need within the healthcare system to help them get better quickly. So we think about a housing crisis in the same way, because the level of housing crisis can vary from somebody who maybe has been staying with friends and family and is getting kicked out because some mediation needs to happen, or they're fighting, to someone who's been in and out of our homeless response system over a period of time and has many episodes of homelessness, higher barriers to resolving their housing crisis. They may have experienced lengthy times of homelessness that have resulted in a deterioration of their physical and mental health. So treating those two scenarios in very different ways and making sure that an appropriate level of response and services is provided to that person. So again, we think about it kind of in the same way as the healthcare system, in that we're kind of triaging, making sure that the response that we provide is appropriate to the level of housing crisis. So we're going to talk a little bit about what the word homeless means. And many folks have kind of misconceptions about what homelessness means. In conversation, you may hear somebody say, I'm homeless. And that might mean that, again, they don't have their own home. They've been kicked out. Maybe they've had faced an eviction and lost their rental unit. To anywhere from what we typically, when we hear the word homeless, we think of someone standing on the side of the road with their cardboard sign asking for help or trying to solicit money from people. And you think of that person as very disheveled, maybe has, backpacks with all their belongings next to them. But that's typically what we think of as homelessness. And it's faceless and nameless, right? So when we talk about experiences of homelessness, we try to focus on the individual and the person first, instead of labeling them as a homeless person, and changing that dialogue to thinking about people experiencing homeless episodes. So we're going to go a little bit into detail about what the definitions of homelessness are now. Literal homelessness refers to people that are sleeping out on the street. It could be another place that's not meant for human habitation, such as sleeping in their car, their vehicle, an abandoned building, a bus terminal, wherever they can find a place to lay their head and rest for a little bit of time. Imminent homelessness refers to the risk of losing their housing within a short period of time. That definition of how long they might be without housing. So it could be that, a friend or family is willing to take somebody in, but they're only allowed to stay for a very short period of time. Maybe that's up to 2 weeks, maybe that's a month. So within our homeless response system, in that flow chart of services that are available to folks, the definitions of homelessness matter for eligibility of services. So the imminent homelessness is an important one to focus on and think about. The definitions of homelessness are defined by our federal government. These are the HUD definitions that we have to abide by, again, that can determine eligibility for services within our system. So that category 1 is under the HUD definition, the literal homelessness. So lacking on nighttime residence, sleeping in a place that's not meant for human habitation, on the street. This can also include if they've been admitted to an emergency shelter, a transitional living program, if somebody is staying in a hotel, but it's paid for by a charitable organization, by federal or state or local government programs. Those all qualify under this category 1 of literal homelessness. Category 4 speaks to attempting to flee a domestic violence situation. And I will note that under our homeless response system, there are separate categories of services that are available to folks that are experiencing domestic violence. They have their own separate hotline, their own domestic violence shelter system. But based on how somebody may answer some questions at that initial call to 211, they may be diverted to the domestic violence hotline instead. Again, based on how questions are answered on at that second stage of the CAN assessment, we may redirect folks that are in danger because of domestic violence to their system as well. Category 2 and Category 3 under the HUD definitions of homelessness are important to recognize because, again, for eligibility for services, within our homeless response system, category 2 will allow for some services to be provided, whether that's financial assistance or case management, or an emergency shelter stay is necessary. So we define that imminent risk of being at risk of losing their home within 14 days. So maybe somebody is facing an eviction, they're in housing court, they've received what is called a notice to quit. They know that the process is underway and they're going to have to leave their unit, but they may have some time while that works through the court system. So that 14 days is an important thing to note of the time frame as to eligibility. So category 3 speaks to imminent homelessness, but as defined under other community partners, other federal statutes. So for instance, under the education system, within our public schools, they are also mandated to identify families, children, students that are experiencing an episode of homelessness, but it's a little bit broader than that 14 days to imminent risk. That can include some couch surfing, which we're going to discuss in the next slide. So what is couch surfing, or what we tend to call folks being doubled up? That's not going to be the folks that you think of sleeping on the street with their cardboard signs and all their belongings next to them, but can be as equally traumatic for folks and can lead to other deterioration in other areas of their life, trying to access, where to shower. And couch surfing can really, it has a lot of gray area and a broad spectrum. So couch surfing could mean that somebody has an aunt that has a spare room, and they can stay there for a couple of months. It's a more stable couch surfing situation than folks who might be picking up the phone kind of frantically on a daily basis to try to come up with a place to stay for their family, for them or for themselves for that very night. And people rely on what we call natural supports. That is usually friends or family, but can be anywhere from an acquaintance that somebody knows, a friend on Facebook, to a friend of a friend of a friend that they heard might have a couch they could sleep on. So it's a higher level of crisis there, and a more difficult situation to try to resolve. So some questions to ask when assessing for a housing crisis and thinking about some of those doubled up couch surfing situations. And certainly these are questions that you have to kind of gauge the person's willingness to share their specifics of their situation. So thinking about, how you conduct those conversations is important, but here are some of the questions that you might be wanting to think about and wanting to ask. So sleeping arrangements, right? If somebody is doubled up and staying with some natural supports, they may have a couch, they may have their own spare bedroom to stay in, or often what we find with folks that are living on the poverty line or the poverty level, often their natural supports are also in similar situations. So we find one bedroom or studio apartments that are crammed with folks, people sleeping on the floor, possibly just to keep a roof over their head. Other questions to ask would be, is there electricity where they're staying? Is there running water? Is the plumbing reliable? Are there any issues with infestation? Some of these scenarios where people are staying, when we really dive into the questions here, we find that maybe it's a rental unit, and they've got, it could qualify as a home, but when we get into these questions about infestation, about the habitableness of the unit, oftentimes we do find out that it would qualify them as a place that's not meant for human habitation. So getting into some of the specifics there and asking those questions. Along the same lines, behavioral health concerns. Is there drug or alcohol use, especially if you have young children and that you're planning on bringing to stay with someone? Does the parent decide who has access to the children? Are there strings attached that the person that lives there is requiring of the household in order to allow them to stay? And again, thinking about domestic violence, human trafficking, really trying to make sure that the safety of the household is first priority. So within our Connecticut's homeless response system, we model it on a housing first approach. And what that means is that homelessness is a problem with a solution, and the solution is housing, right? So we think of, again, thinking about that person standing on the side of the road with their cardboard sign. They may be experiencing substance abuse. They may have severe mental health concerns that haven't been addressed. There are plenty of other barriers to housing, evictions, lots of things that people have gone through to get to that point of needing homeless response services. And within our system, within the services, within our providers, we all work on the same thread of thinking that while there may be other problems to solve and other services that might benefit somebody, the one service that is crucial is putting a roof over somebody's head, and that takes precedence before addressing any other concerns, right? Without an address to put on applications, without a place to safely take care of personal hygiene, all of those other issues cannot be addressed. So we really focus on this housing first approach. So again, our mission at CCEH and within the providers statewide is to make homelessness rare, brief, and non-recurring. So at that initial intake, the call to 211, we're working with folks to create a vision, to set goals for them, to get them out of homelessness as fast as possible. We're using active and empathetic listening. We're making sure that this is a client-led problem-solving conversation. So we're looking to identify clients' strengths, really focus on what their choices are. They're the experts in their own lives, and really making sure that it's a client-led conversation. Again, we're highlighting strengths. We're making referrals to other state and local agencies, connections to employment, mental health, and other supports that will help set people up for success. But again, on a housing first principle, and making sure that that roof over their head is the first thing that we take care of. Some common barriers to housing, folks that are living on the poverty line, low income, specifically, those that are maybe on state benefits, disability benefits, and can't afford their own housing. Lack of family or friends, maybe that's burnt bridges, or maybe it's just somebody that never really had those supports. We see our 18 to 24 young adult population often are folks that have bounced through the foster care system, never really had those connections to start with. Substance abuse, criminal background, folks that may be on the sex offender registry are going to find it much more difficult to find a landlord that's willing to rent to them. Felonies, all of those are barriers to finding rental units or even friends or family willing to take folks in. Again, mental illness, past evictions, foreclosures, and we find within our system that often pets can be a barrier as well, depending on the breed of dog. Landlords asking for higher upfront costs, double security deposits, pet deposits, in order to be willing to rent to folks. And so all of these barriers to housing can cause folks to land in an episode of homelessness and need services within our system. So what services are available through our CAN system? So within our coordinated access networks, our 7 regions, there are resources available to help, again, move people as quickly as possible out of any homeless situation. So emergency shelter is reserved for when it is deemed as a very last resort. During COVID, we've worked really hard within our system to make sure that the least amount of people are sent to that emergency shelter kind of congregate setting space. And so we have moved some folks from emergency shelter and have provided some hoteling services. That's kind of unique to the time period that we're working in now, and really making sure that we're addressing the health crisis of this pandemic. So hoteling is something that does happen in lieu of an emergency shelter stay sometimes. Referrals can be made from the initial call to 211 to the CAN assessment. Outreach workers, shelter case managers are all well versed in what referrals they can make to their local community partners. So referrals for mental health services, substance abuse, medical services, employment services, legal services, oftentimes that falls under the fair housing jurisdiction. So teaching people their tenant and landlord rights and responsibilities, knowing where your local food pantries are, other places that people can go for, help with basic needs as clothing, hygiene products, and things like that. Through the CAN system, case management can be available, and that can range anywhere from a really light touch to some severe, intense case management. So that light touch kind of happens at that initial call to 211, the CAN assessment, and maybe it's just some quick, mediation, education of what the system is and what services are available, to the highest level of housing intervention that is available for folks that have experienced lengthy periods of homelessness and have kind of bounced in and out of our system, to a very severe, intense case management that's available for those folks that can get matched to a permanent supportive housing program. And these are all based off of what the client's needs are, how they score on that vulnerability index survey, as well as the experiences that they have in working with either an outreach worker or shelter case manager, whoever that may be. Another service that can be provided through the CAN system is assistance in housing search. So within those 7 regions, our providers work together to work on landlord engagement, pulling in as many landlords that are willing to work within our system to receive rent checks, maybe from some of our providers or from CCEH. Advocacy, education, teaching folks, again, fair housing laws, lease compliance, how to be a good tenant, things along those lines can be available as services through the CAN system. And then lastly, financial assistance, which can range from one-time diversion assistance, getting folks just at one bump to cross over whatever their hurdle is to be a little more stable and on their feet, to rapid rehousing, which is short-term rental assistance with some lighter touch case management, to that permanent supportive housing that's a long-term rental assistance with more intense case management available. So that brings us to who should call 211 for housing assistance. And this is going to be important for those of you, working in the library setting, encountering people that need to get hooked up with our system. And how do they do that? So who should call 211 for housing assistance? Those that you can clearly identify as being literally homeless or in what, that place not meant for human habitation. So thinking about those folks that might be sleeping in their car, an abandoned building, on the street, literally on the park bench. Those folks immediately should call 211 for housing assistance. But also that HUD category 2 of imminent homelessness, which is why that 14-day period is important. You may hear from folks in the community that say, hey, I called 211, but they didn't help me. I mean, we hear that from other partners. And really that speaks to somebody may have called 211 because they legitimately are experiencing a housing crisis, but they can stay where they're at for a duration of time that's longer than 2 weeks. They would not be given a CAN appointment to discuss the other services and the problem-solving conversation that happens more in depth, because we want to reserve those resources for the folks most in need. So when you're calling 211 for services specific to housing, what you will do is call 211. You'll dial 3 for housing. The menu options will kind of walk you through this computer automated system. So press 3 for housing and then press 1 for housing assistance. There are options for hearing impaired individuals, 1-800 number that they can call, as well as the option for text communication. If you text CT-CAN to 898-211, I will say that the text option is great, especially working with folks that maybe have a state phone with limited minutes. Text communication can be great for those folks, but I will say that that text communication to 211 likely will result in needing to have that phone call. So they may be able to set up a time, a phone number, if the person is maybe using someone else's phone, they can connect them that way. Always try to have a pen and paper ready to write down important information at that 211 call if they're unable to divert the client to somewhere safe, and they need to schedule a CAN appointment. Being able to write down what the date and time of that appointment should be within 1 to 2 days. Most of our regions are able to schedule those appointments rather quickly, and then remain on the call and wait for an agent. When you speak to an agent, if you're calling with a patron, make sure that you're prepared to explain the current situation, answer questions about the patron's circumstances, their current documentation, and their living situation.
Great, thank you so much, Diana. We really thought it was important to just start with our homeless response system, giving an overview of that and talking about what services are available within our system, as well as how to access it. So you all will know if you encounter someone that is in crisis or an individual that is experiencing homelessness, how to go about accessing supports and services for them. So as I mentioned in the beginning of the presentation, libraries are increasingly a point of contact, of connection between the front line for people experiencing homelessness. I'm sure you all see a lot of individuals that come into your library during the day, and a lot of times people are going there to have shelter, right, from extreme weather. As the weather is getting colder, it's a place where they can go during the day. They know there's heat. They know there's a restroom. They know they can just sit and they spend some time. They also can receive supports, and they can use resources such as the internet. Individuals use the internet often, right, to look for any available housing units. They look for employment. They look for just spending time, right, as a downtime and seeing what's going on in the world. Also, with COVID restrictions easing up, there may be more people that will be coming to the library. Numbers have probably declined because of COVID, but now many more people will probably come to the library to see, just to go during the day and to have access to the different resources that are available. The library also creates an opportunity to do outreach and shelter diversion in order to direct patrons to resources and housing. As we said, many individuals that are experiencing crisis often go to the library. So it's an opportunity to connect them to available resources in the community, or to connect them to their case manager or different outreach workers, or to have those conversations that Diana mentioned, and see if they can be diverted from the shelter, or if they're experiencing any type of housing crisis. So before we go into the next section, I just want to talk about there are a few ways that you can identify individuals in crisis. These are some very clear ways, right? And we're going to go into this in a little bit more detail. But if someone is wearing clothes from a season different than the current one, so if it's summertime and someone still has on a big heavy coat and boots, most likely they're experiencing housing crisis because they have on those heavy clothes because they have nowhere else to put them. So they're wearing everything that they have at that time. If you're noticing body odor or if the individual has substances such as dirt on their clothes, most likely they don't have access to a shower or other clean clothes. If they're carrying many bags or excessive items around that don't seem like library materials, it's most likely because they're carrying everything that they own, right? They don't have a safe place to put those items. So they're carrying it with them where they know that they will be safe with them. Also, if you're seeing people there regularly, if they're spending an extended time at the library during the day, it may be because they lost their job and they haven't told individuals yet, so they're going to the library to use the computer, or they just need somewhere to go, or they don't have a place to go during the day, so they're at the library. If they're spending most of their day sleeping, they most likely are in a crisis or be homeless because at night, you know, being in the shelter or being on the street, you don't get a good night's sleep, right? You don't feel safe. You're not comfortable closing your eyes and resting. So you stay up during the night. And during the day, you sleep in a place where you feel safe and comfortable. So if they're in the library and they're taking a work study room or something like that and they're sleeping, that's an indicator that they're experiencing some sort of crisis. Also, if someone is having maybe there's some mental health concerns, you may see them talking to themselves, or if they're having any type of angry outburst or response to certain questions, especially questions around their residency, they are they're being defensive, right? They're being defensive. There's some type of crisis going on there, and they may just not be ready to talk about it yet. But that's an indicator that someone is experiencing a crisis also. But I will say that all of these are very clear examples that someone's experiencing a crisis. However, identifying someone in crisis is not always so obvious, right? There's no clear indication. There's no particular look to someone that is in a crisis. There's no particular smell. There's no clothes. There's no race. Not everyone that is experiencing a crisis has a substance abuse disorder. Not everyone has a mental health problem. Not everyone walks around with a lot of clothes. Sometimes the individuals can look just like me or you. You just never know what truly is going on with the person. So although these are very clear and very obvious signs, you truly don't know. And that's why we're going to spend some time talking about how to have those conversations, how to assess and pick up different behaviors and ask particular questions to see if someone is experiencing a crisis. Diana has done a lot of work actually in the field, and I know she has some very clear and specific examples for this last one. So Diana, can you speak a little bit about those examples of different people you encountered that are experiencing crisis?
Yeah, absolutely, Amber, and thank you. To your point, Amber, always making sure that we remain non-judgmental. You know, so taking that kind of picture image that you have in your head of the person on the side of the road with their cardboard sign. As Amber stated, I have years of experience working within the field, conducting CAN assessments, and also doing street outreach. And I can say that you know, one particular client does come to mind that stands out. Individual, we'll call him Paul, had been sleeping in a tent in the woods for upwards of 7 years. But this gentleman did come to see me on a regular basis because he requested crisp, clean white socks. To view this individual, you would see that he is very well put together. His hygiene was always taken care of. And you wouldn't necessarily think that this is someone that's experiencing especially a lengthy episode of homelessness as this particular person did. But the barrier for him happened to be really high anxiety, and the way that he managed that was to find places. He had a regular routine daily where he would go and use local bathrooms, and that may have been the library or Dunkin' Donuts, to take care of his hygiene. And he always had clean clothes, very rarely carried his belongings. His tent that he had set up was an undisclosed location, but I did actually end up viewing his location, and had a rather elaborate setup. You can imagine survival is a skill that's necessary for folks that are experiencing homelessness, and they may take care of those survival skills in many different ways. So just kind of taking a step back, making sure that we recognize we haven't walked in someone else's shoes, and the way they present to us can look very different.
Great, thank you. So before we go into this next section, I just want to ask you all, do you think that your current library practices are equitable? We don't have the chat feature on this, but if you all can just put your responses in the question spots, and it will come directly to me, so no one will see, you know, what you're saying. But do you all believe that your current library practices are equitable? And when I say equitable, we're talking about characterized by equity or fairness, just and right, fair, impartial, and reasonable. I see some are coming through. All right, we have someone that says not yet. Not yet, but hopefully, as we continue on this training and the next one as well, we can get them there. Equity is a daily practice. We strive and adjust constantly. Our outreach does not hit that mark. All right, thank you all for your feedback. Somewhat, we're getting there. It's definitely a work in progress. It's definitely a work in progress, and all we can continue to do is continue to learn and practice. So thank you all for your feedback. But I want you to keep that in mind as we go through this next section about the library and you all working with our folks that are experiencing a housing crisis or homelessness. So oftentimes when people are working with individuals that may be experiencing some type of crisis, sometimes people don't really know how to interact or engage, or how do I, what's the best way for me to address this without insulting someone or without, you know, making people feel uneasy. It's a hard topic to address. It's a hard topic. No one wants to discuss certain things, but it's necessary. It's necessary. So we're just going to give you all some suggested practices for library staff that can help you navigate this a little easier. And we're going to talk about it in a little bit more detail. So for one, we encourage you all to develop a system for speaking with identified individuals through a trauma-informed lens, meaning knowing that everyone is experiencing some type of trauma, and that trauma can have an impact on how they interact with others as far as just their behavior, how they respond in certain situations, and their overall interaction with people in general. We encourage you all to do active listening. So you're not just listening to have a response, but you're listening to what the individual is truly telling you. As Diana pointed out, those different questions to ask someone. So you're listening to see, are they possibly in any type of crisis? Are they experiencing anything? They may not just directly say it, but if you ask particular questions, they're telling you in a way that's maybe not as direct, but they're still telling you. So really listen to what it is that they're saying. We encourage you all to address individuals with eye contact and a soft voice to prevent any type of escalation or promote respect. Also, basic stuff, you know, treat individual the same as you would like to be treated. Treat them the same way as anyone else. You don't have to treat them any differently. They are human beings. They are just in a housing crisis or experiencing homelessness. As people come in there on a regular basis, just learn their names, you know, and begin addressing them by their name. It will help you to build some type of rapport with them. If you notice someone that's coming in regularly, ask them questions about how their day is. And if there's anything that you can do to assist them with anything. You don't have to ask them, are you experiencing a housing crisis? Are you homeless? Do you have any substance abuse? You don't want to ask them those questions, but just simply say, can I help you with anything? How are you doing today? Have a dialogue with them. And as I said, when you're having those kind of conversations and after time, when you build rapport with them and you're really listening, then you can assist them and assess their needs. So of course you want to avoid touching, even if it is a friendly touch, right? You don't know how someone may respond. As we said, have a trauma-informed lens. You don't know how someone may respond. So you may not want to approach someone from behind and touch them on the shoulder. You don't know how they will respond. So avoid touching them and physically dominating them. Instead, you want to stand next to or in front of them. And lastly, have some resources and services that are easily accessible. We're talking about having a conversation with someone. We're talking about actively listening. However, not everyone is going to just disclose what's going on with them, right? They may not feel comfortable. They may not want anyone to know. But if you have the services and the resources that are right there for them, maybe some pamphlets, then they can get what they need without even having a dialogue. You connected them to some resources, which are very, very helpful. So some other suggested practices for you all is, if you need to ask someone to leave the library, address them quietly and respectfully. Hopefully, I don't know how often this happens for you all. Hopefully it doesn't happen very often, but if you do need to, you can just say, hey, John, we have a policy that says there's no fighting, so we can't let you stay for today, but let's try again in a few days. And when you do that, you're showing them that they can still come back and they can start over with the clean slate. It shows them that there's rules, and when you break the rule, there is a consequence, but it can be repaired. It doesn't mean they can never come back. Also, just make it discreet and bring them into a private or less crowded space to avoid attracting unnecessary attention. So with this last slide, it kind of goes with my original question, asking if you all thought that your current practices were equitable. And I just kind of want to challenge you all a little bit. As I got a lot of feedback, it sounds like you guys are on the right track. You're constantly working, and that's all we can do. So here's a few things for you all to take into consideration as you're continuing on your journey to make sure that your practices are equitable. So the first one is to maintain fewer rules rather than more rules. So this can help compliance among every patron. So if you keep your rules very short, and to the point where it is maybe just having 4, maybe just respecting those around you, right? No fighting, no weapons, use indoor voices. That still allows individuals to come to the library, access books and resources and sit and do as they wish, but there's not tons of rules. And when there's tons of rules, it can create some barriers for individuals. So the second one is also to review your current practices, rules, and policies and determine if they're equitable or if it creates barriers for your library guests. So take a look at the rules that you currently have in place and see, are these good? Right? Are these equitable, or does it create barriers for individuals? So many individuals go and they use the internet, they use the computers, and they may be looking for jobs, or they may be looking for housing or other resources, but They may not have a personal ID or documentation, and sometimes that's a requirement to get a library card. So that's creating a barrier for them. Is that truly necessary? If you offer some alternative library IDs, that can help diminish the barrier. This is just one example, but I want you all to think about some current practices you all have and think about if they're creating other barriers for your individuals. And then lastly, think about the why behind the rules and the policies that you have in place. Why is it necessary? Is it necessary at all to have that rule? Is it necessary to have that practice? What is the purpose or the intent of it, right? So why is it necessary to charge someone for a temporary library card or to use the computer? Is it truly necessary, or is it just a rule that you all currently have in place? And feel free to send me some comments and feedback in the questions box for that. But those are just a few examples that I can think of at the top of my head of some practices that I know that libraries have. I'm reading different questions that are coming through. We have some response where last year, some individuals eliminated the need for ID to get a computer guest pass for this reason. Perfect. Okay, I don't see any others coming through. But yes, I challenge you all to go back after this training to really go through your list of different rules that you have and see if they're equitable or if there's any barriers that you're creating by having them. Okay, so, and then we also have another response where someone says that it's not necessary to have an ID or library card to use the computer. So it sounds like you all have started making steps to make sure that your practices are more equitable and removing those barriers that have been in place. So those are just a few examples, and just going to go over some best practices used within our homeless response system that you all can take and hopefully use within your library system. So handing it over to you, Diana.
Thanks, Amber. Yeah, so we're going to talk about best practices. Some of these are techniques used in problem solving conversations, as well as just kind of a framework for how we do those conversations. So our providers statewide, our partners within the 7 CAN regions are all trained to think about these best practices and techniques. So we encourage you to get familiar with them. We're going to go kind of briefly overviewing, but there is more in-depth training for each of these techniques that you can access, and we can give you those resources as well. So first, Amber spoke a little bit, I spoke a little bit about really making sure that we have a trauma-informed system of care. So thinking about the safety of the individual or household, and that's not just, you know, we think about folks that are fleeing domestic violence. It's not just physical safety, but emotional safety, and that can change how we pose conversations, how we address folks, to really make sure that we are being trauma informed. Some of the questions and the ways that Amber directed you all in interactions with folks that you might question are experiencing homelessness. So really make sure that you maintain appropriate boundaries, and by addressing somebody by their first name, for example, you are setting a stage for building some trust and rapport with a person. Making sure that client choice is always prioritized. Again, that folks are the experts in their own lives, and so we're really making sure that we are addressing conversations about homelessness, about housing crisis, in a way that focuses on their client choice. We're maximizing a collaboration again, so this is trust building, this is trauma informed. We're sharing a collaboration of conversation, helping people to identify, you know, next steps, what what they can do actively to help resolve their own crisis. So really working in collaboration with folks and not telling them what we think they should do is also empowering, and we can work on skill building. We're really trying to be strengths-based, identifying their strengths and helping them on their way. We're also really trying to be culturally responsive, right? So thinking about, you know, taking a step back from your own beliefs, your own religion, your own background, to respect someone else's cultural differences, gender issues, folks that identify as part of the LGBTQ+ community, really taking into account how someone else sees the world versus our own worldview. So even folks that maybe think of themselves as very open-minded, non-judgmental, we all carry with us some kind of bias, whether that's an explicit bias that you might have on a conscious level, or to an implicit bias that maybe is in your subconscious that you don't necessarily identify that you might stereotype someone. There is a great test. I encourage you all to take the implicit bias test that you can find online. There's a link here for it. Again, you'll get the slides and the recording for this webinar so you can access that. Really just helps you in your everyday interaction with folks that are experiencing homelessness to identify your own bias so that you can eliminate that from, you know, your judgmental, hopefully non-judgmental, but really to create some trust, create some a safe place for folks to talk. So I encourage you again to take the test and see where your own biases may lie. Amber, can you forward to the next slide?
There is a bit of a delay. It didn't come up on your screen at all?
Yep, got it now, thank you. So that brings us to active and empathetic listening. Again, this is a best practice, a technique that is used by our case managers, outreach staff, diversion specialists, and really it's about being a good listener, but it goes into more detail than just listening, right? So while that sounds like an easy feat to be able to listen to somebody, really being an active, good listener, being empathetic to someone else's thoughts and feelings without adding our own judgments can be very difficult. So I encourage you again to start to think about active and empathetic listening and really honing in on those skills. There's a slew of further training that you can take on active and empathetic listening. You know, I love that we can reach a broader audience with a webinar, but when we do some of these trainings in person, we've always done, you know, kind of a skill building, active and empathetic listening kind of little exercise. And you'd be surprised how folks who think that they're great listeners want to interject when somebody's talking, want to provide, you know, your own opinion, and really taking a step back and listening to somebody can be more difficult than you think it is. So really thinking about how you interact with folks and making sure that your listening skills are honed in on. Motivational interviewing is a technique, again, that you can attend. We've provided at CCEH some 2-day trainings, some more intensive motivational interviewing trainings. Really the root of motivational interviewing is asking open-ended questions, right? So something that is not going to give you a yes or no response. You can ask somebody, are you looking for a job? They're going to say yes or no. If you ask somebody, tell me about your job search, you're going to get a full, more comprehensive view of their situation from their own perspective. So again, listening reflectively, affirming positive behaviors, And summarizing can be really crucial here. So when somebody tells you their situation and they go into all this detail, when you summarize back, you're letting them know that not only you heard them, but you understand what they're going through. So these 4 components of motivational interviewing can be really helpful for folks that are experiencing a housing crisis. One of the things that we kind of teach in some of these trainings is that being in crisis mode literally can change the brain function of somebody who's trying to work through problem solving, right? So being in crisis can put people into what we call a fight or flight mode, and that conversation, that problem solving skill can be disrupted. So by working through some of the motivational interviewing best practices, you can help somebody kind of get past that flight or fight and crisis mode to really come up with some solutions. Some do's or don'ts for motivational interviewing. Explain what the conversation is going to be about. Asking permission to discuss a person's housing situation, right? Asking permission can go a really long way in building trust and letting folks know that it's a safe space for them to talk. Really focusing on understanding someone else's worldview. Some don'ts. Do not give advice. Don't try to solve the problem for someone. Again, we really want to be client focused, client choice, strengths based. So really not giving your own ideas and letting the client lead the conversation is important. Having distractions while the person is speaking, or speaking over them or cutting them off. Some of these don'ts, if you speak over somebody, if you're constantly interjecting your own opinions, they're going to put up a brick wall and they're not going to want to discuss their situation with you. So really trying to make sure that a safe space is created. So some do's and don'ts to think about. Responses to motivational interviewing, when it's done well, the patron will feel understood and accepted. They'll be more willing to follow a plan that they've helped create and set in motion. They'll have feelings of hopefulness and they'll be engaged with you and want to speak to you. When motivational interviewing is done poorly, people will feel judged, disrespected, less likely to follow your advice on what you think their plan should be. They will likely shift back towards hopelessness and they will disengage with you. Again, there's further training. There's motivational interviewing training is something that even if you've had in the past, going back and getting a refresher, learning more about the topic can really be beneficial in working with folks. I love this slide because not only do I love Fred Rogers, but this quote really speaks to meeting folks where they're at, right? So the quote here is, love isn't a state of perfect caring, it's an active noun-like struggle. To love someone is to strive to accept that person exactly the way he or she is, right here and now. And so I love this quote because within our homeless response system, within our best practices, certainly we're not going to love every patron that walks in and out of your libraries or love every client that has experienced a crisis, but respecting that they are going through many levels of crisis, housing, mental health, substance abuse, all of those barriers that we talked about before, and really trying to be non-judgmental, taking a step back, knowing that we haven't walked in their shoes, and accepting that person, how they present themselves that day and that time, and really getting them connected to resources regardless of what their situation is. So when we're talking about highlighting strengths, it's really helpful to think about some of these questions, right? So questions you can ask to find out some strengths that a person might have are, who are their allies, friends, family members? You know, when they're in crisis, when they pick up the phone, who are they calling? Is it a friend? Is it a best friend? Is it a cousin? What were things like for them when things were going better? What's the last time that they were stably housed, and what did that situation look like, and how can we help you get back to that stability? maybe who have they helped in the past, right? So they might have acted as a natural resource for someone else in their inner circle, right? They may have let a friend stay on their couch for a brief period of time in the past. So thinking about who they may have helped that they could reach out to now that they're in crisis themselves. Really identifying networks, support people, what resources they have at their disposal to help resolve their crisis. So now we're going to talk a little bit about the basics of shelter diversion. Now, shelter diversion is a term that we use in our field. Really what its focus is preventing and ending homelessness. So it's a strategy that's used at the front door, at that initial call to 211, at that initial stage of identifying a housing crisis, to help people identify immediate alternative housing arrangements, to connect them with services, so that we have a short-term plan and that we have a long-term stable housing plan in place for folks. And again, this shelter diversion as a practice is rooted in the mission and vision of CCEH and our statewide partners to keep episodes of homelessness, again, rare, brief, and non-recurring. So every effort is made to divert folks from needing emergency shelter or experiencing a literal homeless episode. This slide speaks to the changes in our system. Over the past 5 years or so, we've really worked to make it a more effective system. Prior to the CAN system being set up, the 211 hotline being available to all folks, people would have to go to shelters and maybe knock on the door and say, do you have a bed available? Other community partners kind of worked in conjunction with that, where the criminal justice system, social service agencies, the school systems would help people call shelters, and they'd have to call multiple shelters, 4 or 5 shelters, to see if there are any openings. And really the focus was, if you're homeless, you need to enter emergency shelter. And we've changed the way we think about things to be housing focused instead. So somebody experiencing an emergency housing crisis, our focus is how do we get them housed and not how do we get them into emergency shelter. So all of the providers that we work with statewide, grateful to having you folks join us today to learn about shelter diversion and why it's so important. So why do we do shelter diversion? Again, it prevents experiences of homelessness, and homelessness can be a trauma in itself, so we want to keep folks from having to experience that. It's a better utilization of resources, right? So it's cost effective. Emergency shelter stays, while they're free to the individual that needs it, it's not free to us as a state. So we want to make sure that the resources that we have, the funding that we have, gets used in the best way. And we find that getting folks housed instead of placing them in shelter or transitional living programs is a better utilization and is more cost effective. Again, it reduces trauma and it reduces repeat experiences of homelessness. So the reason that we implemented shelter diversion statewide, and we want to teach as many community partners about shelter diversion as a practice, is that we're improving system outcomes by reducing entries into our homeless service system. It improves the quality of life by helping people avoid the stress of shelter stays. It conserves and targets resources, so the folks that are most needy, most vulnerable, can get access to the services that they need, and it conserves and targets those resources for only those that are in emergency crisis and absolutely are in need of that. And we're cutting down on wait lists of folks that might be sleeping outside and in need of shelter. To talk a little bit further in depth about how cost-effective diversion is, a simple phone consultation, that CAN assessment, an hour-long problem-solving conversation, can be free to the person, and we can come up with a solid and stable diversion plan for somebody. It can also be some simple mediation, maybe between friends or families that have been a natural support, that that support has fallen apart. So some mediation, possibly some financial assistance for the household that they may be willing to stay with. Sometimes it's locating a natural resource that's out of town and somebody just needs to get to a stable housing situation and they don't have the means to get there. So we can, in some instances, purchase bus tickets for folks, as long as we know that we're not sending them from one homeless situation to another, really to make sure that there's a stable place for them to stay once they get where they're going. We can provide, again, some simple financial assistance, like help with an overdue utility bill or other hurdles, financial hurdles that folks are facing. And oftentimes for those people that are living at the poverty level, paycheck to paycheck, it's very difficult for them to find a new rental unit because of the upfront costs of coming up with the first month rent and often security deposits. In this day and age, it's very, very common for landlords to request double security deposit. So depending on the size of the household, rental costs and deposit costs can be upwards of, this says $1,000 plus, but it could be upwards of $3,000, and can be very difficult for a household to save up that money when they are either couch surfing or bouncing around. It's much more less expensive for us to focus on diversion than some of the other resources that can be available to folks, such as an emergency shelter stay, a rapid rehousing. Rapid rehousing can be anywhere from a month to up to 12 months of rental assistance, and that can be very costly on our system. For folks that are experiencing street homelessness, they're more likely to be hospitalized or go through the judicial system, and all of those other emergency services are expensive for the state as well. So we find that getting folks housed quickly is definitely more cost effective. I really want to point out, and we've talked about being trauma informed, but really homelessness in itself is a traumatic event, right? Trauma is defined as a psychological, emotional response to an event or experience that is deeply distressing. And so folks that are experiencing homelessness, that are in housing crisis, are, and this isn't to label anybody, but to really make sure that we understand that any kind of housing crisis, any kind of homelessness is a traumatic event. And traumatic events that happen over an extended period of time can lead to complex trauma, which can manifest in the deterioration of both physical and mental health. So that's another reason that we really try to make sure that episodes of homelessness, again, are rare, brief, and non-recurring, to reduce the amount of trauma and the effects that it has on a person. People with trauma can often feel shame and hopelessness. And so, you know, all of those tips that we gave you for how to speak to somebody, how to approach somebody, those are important as well. For families with young children specifically, the trauma of homelessness can manifest in adverse childhood experiences. This is called ACEs. So those of you that have any experience in the medical field or maybe with GCF may be familiar with this, but children who experience homelessness have greater negative health outcomes. So an emergency shelter stay or sleeping with a parent in a vehicle can lead to more health issues such as asthma, allergies, respiratory infections, etc. They are more likely to be hospitalized. And to me, the most important thing on this slide is that to recognize that experiences of homelessness, episodes of homelessness that happen in a child's childhood are predictors of future episodes of homelessness. So they're more likely to experience homelessness again as an adult if they've experienced it as a child. So it's just one more reason why we really try to focus on making those episodes as brief as possible, especially for children. So this next slide actually shows what an emergency shelter looks like, and I encourage you, if it's a possibility in your region, to go and take a tour possibly of the shelter that that you have in your area. Oftentimes they are congregate settings, dorm rooms. So for the single men, single women, there'll be separate dorms. Oftentimes even family space is shared family space with other families, shared bathrooms, very little privacy. And again, you're sharing space with folks in other housing crisis and dealing with their own issues. So shelter realities, I think breaking some myths about what emergency shelter actually looks like is important before we start talking about whether or not a shelter stay is deemed necessary. Some key points here that I'd like to make you aware of is that the shelters in Connecticut, we try to make sure they're as low barrier as possible, so folks that are in need of shelter can access it no matter what they are experiencing. For folks that may be experiencing substance abuse, our shelters across Connecticut are mostly what we call wet shelters. So folks that have been using substances during the day are still allowed to come in at night and lay their head. There are rules and policies for safety. Certainly if anybody is creating an unsafe space for themselves or someone else, they may be asked to leave, but there is minimal staffing. The hours that shelters are available, typically folks are allowed to come in the evening, sleep at night, maybe there's a light breakfast, and often are asked to leave during the day, which is one of those reasons why they may end up coming to utilize the library. So how do we do effective shelter diversion? This is based in a lot of those techniques that we talked about previously, active and empathetic listening, motivational interviewing, being client-centered, strengths-based. So really this starts with creating a safe space for someone to feel comfortable, not judged, and really speaks to some of those tips and what Amber had given you as ideas on how to approach somebody. So, you know, introduce yourself. My name is Diana. What's your name? Describe what the conversation is going to be about. Asking permission to talk about sensitive topics. Within our system, we're doing a lot of things by phone. So I include here the difficulties of using a phone call versus an in-person conversation, which you're less likely to encounter for folks that are coming in and out of the library. So shelter diversion is a conversation. You should be listening, and the person experiencing housing crisis should be the one providing more of the talking, right? So you are identifying natural supports, helping them to highlight their strengths. You can provide guidance and information, having local resources available, maybe even a little bit of reality testing, right? So somebody says, I'm making $700 a month on disability, and I'm looking for a rental unit, or maybe you find them on the computer doing an internet search, trying to find a unit, and they're looking for rentals that are 800 and up. So some reality testing can be helpful here as well. The person in housing crisis should be sharing their story, developing their own housing plan, asking questions, taking steps. Sometimes we do some hand-holding, but more often than not, we're really trying to be strengths-based and helping them to identify what steps they need to take on their own in order to secure permanent housing. So some questions to start off this problem-solving conversation. You can ask somebody point blank, do you have a place to stay? Where did you sleep last night? Do you have a place to go tonight? How long have you been staying at the place where you're at? Where's the last stable place that you stayed, right? Maybe somebody's out on the street, but a week ago they left their friends and they've been staying there for a month. So how long were you able to stay at the last stable place? Are there additional reasons why you can no longer stay there? If you or your family could stay temporarily with a natural support, a friend or family member, are there some referrals, other services we can connect you to that would help in that temporary stay? What resources do you have right now that could help you and your family find a place, whether that's temporary or permanent? Have you ever called 211? For folks that are experiencing literal homelessness, they may not even have a cell phone, right? So do you have access to a phone? And if the patron says no, that's been, you know, really hard for me. I can't call 211 because I can't make that call myself. Offering some supports in helping them to make that call with you. So some housing possibilities that are explored, some possible what we call diversion outcomes, right? So going to stay with family, kin, or natural supports. Sometimes it's returning to their own residence, and that can be educating on fair housing laws. It can be some mediation with landlords. Some other possibilities are staying in a sober home. Those are usually a temporary stay for a couple of months and can be a cheaper option for folks that are experiencing some issues with substance abuse. Sometimes we can temporarily divert. So maybe somebody's looking for a new rental unit. They need some financial assistance with first month and security deposit. And they found somebody that they can stay with temporarily there. We talked about, you know, the purchase of bus tickets when appropriate to help somebody permanently relocate to a safe place out of town, and often shared housing. So finding a roommate can be the thing that helps resolve a housing crisis.
All right.
And on that, I'm going to turn it back over to Amber.
Great, thank you. So I know we don't have much time. I'm going to quickly go over some resource mapping for your community. It's really important to know about the available resources. As we said, a lot of individuals that are in a crisis come to the library as a means to use technology or find some type of support. So it's really important for you all to be knowledgeable about your local resources and have information that's easily accessible for them. So having resources available can assist with building rapport, trust building, and then if it's easily accessible for those that do not wish to discuss their current needs, right? It's right there for them. They don't have to discuss it, but you still have the resources for them. So I'm sure many of you all probably already have a place within your library where you have some community resources, but here's just a list of some key ones to have: some information on a local food pantry, some clothing closets, employment centers and opportunities, social services, drop-in centers. Some cities do have drop-in centers where an individual can go and they can take a shower or bathe. Also information on basic needs, if there's mental health services, children programs, a warming center. During the colder months, there are warming centers where individuals, it's not a shelter, but it's a place where individuals can go to keep warm during the day, right? And so they're not have to be on the streets, they don't have to be in the cold weather, they can just go during the day. So every city has some local warming centers. Also, we included some information about different substance abuse treatment resources as well. And of course, we always encourage individuals to have information out about 211. 211 is a great place for all the resources. You can call 211, but you can also access the website and you can filter it for whatever service an individual is looking for, so you can best assist them. So oftentimes there's a misconception that shelter diversion is only done by shelter staff, right? It's only done by people within the homeless response system. That's not true. That's why we spend a lot of time talking about diversion and having those problem-solving conversations, which diversion is. It's all about having a problem-solving conversations. And a lot of individuals come to the library that are in crisis. So we really think it's important for you all to know how to go about having those conversations with individuals so that we can divert them from entering the homeless response system. However, if it is not possible to divert someone, if you're not able to come up with a solution for someone to call a family member, or you gave them employment opportunities, and then they still ended up getting evicted, or it just didn't seem to work out. You can also, of course, connect them to 211, but also connect them to either CAN outreach worker. Each municipality, each city has a CAN outreach worker. We actually can provide a list after this training, so you can access your local CAN and get information on your CAN, so you can find out who the outreach worker is. But oftentimes outreach workers come into the shelter when they're looking for certain individuals, just to lay eyes on them and try to connect them to services within our system. But it all starts with the 211 call. And you can also assist the individual with connecting them to a meeting time, right? If you know someone comes to the library every day at 12 o'clock, when the outreach worker comes, you can say, okay, he's usually here, right, Tuesdays at 12 o'clock, come then. You can also offer a specific place for the private conversation to take place between the individual and their outreach worker. You can make sure that the client has contact information. So sometimes we have individuals that don't have a phone number. They don't have an email account, right? Phones are hard to find, but if they're coming into the library every day, then they have access to a computer, right? You can assist them with creating an email address, and sometimes that's how outreach workers or other individuals in the community communicate with their clients that do not have phones available. You can also give them a way to check in. So you can provide your contact information, your work information, of course, with your email and text options, and then walk-in options, right? So they can come anytime during the day and make that type of relationship with them. And just be a liaison between the client and the outreach worker. I can't tell you all how instrumental the library truly is to our homeless response system, and how often we go to libraries to find our clients and locate our clients. And even after we do house them, sometimes it's just a place where they like to meet because they spend so much time there. So it's really a place of, as I say, a refuge, and it's a safe haven for a lot of individuals, and they truly just enjoy the space. So you all are truly a part of our system, and we really, really appreciate you all. I know that was a lot of information, but we just want to finish off going over some scenarios of some common things that you may experience in a library. So we're going to read the scenarios, and in each one of them, we're asking you all to identify some of the strengths that the individual has. We also want you to look out for some possible clarifying questions that you would ask. So how would you get more information from them? And we are looking to develop potential outcomes or plans for this person based on the information that they've shared. So keep in mind that in actual practice, you're taking into account client choice, right? It's not going to go just as we say it's going to go in this scenario. But for the sake of this scenario, we're going to talk about some potential plans and outcomes. So Diana is going to read them, and as you all read them amongst yourself, if you can just put in the questions box the strengths, some possible outcomes, and what was the last one?
Clarifying questions.
Clarifying questions, thank you. All right, let's start with scenario one.
All right, scenario one. Stacy is in her mid-30s and was previously living in the apartment complex across the street. Stacy was recently evicted after not being able to pay rent. She supports her mother, living in a retirement home, and was unable to make enough to cover both payments. She's recovering from substance abuse and has recently relapsed after losing her housing. Stacy hasn't had anywhere to go since losing her housing and reports sleeping outside. She has been utilizing the library for temporary shelter during the day and taking care of her hygiene. She is often found sleeping in the workrooms for hours at a time and is sometimes talking to herself. So go ahead, take a minute to think, and then as Amber stated, if you could in the questions box, just any strengths that you can identify that Stacy has, some questions that you might want to ask to get a better picture of her housing crisis, And then what are some potential outcomes for a diversion plan that you could help Stacy put in place? And we'll give you a few minutes to do that.
I don't have any responses yet. All right, Diana, for sake of time, how about you give them a head start and help them out with some strengths for this one?
Sure, absolutely. So two things that glare out at me from Stacy's little scenario here is that she had been recovering from substance abuse. So some history of substance abuse, but some recovery time, which points to whether or not maybe she had some services that she accessed in substance abuse. Maybe she attended meetings, maybe she had done some inpatient possibly. So kind of asking some questions to Stacy about how recovery looked for her and when things were going better in that aspect, what other supports she had for her recovery. Another one that sticks out is she has a relationship with her mother. She's been able to support her mom in her own living situation in a retirement home. So maybe there are some other ways that mom can help to support Stacy.
Yeah, perfect. Actually, we did have a few folks that responded with that same information. And I'm not sure if you said it, but also mentioned that she had means to do so and was fiscally responsible. Someone is asking, well, we want to ask if she had friends in the apartment complex, possible people she can go to for help. Okay. All right. Yes, those questions will be appropriate as you're exploring what her other options are. Let's go to scenario 2 so we can have time for additional questions and answers as well.
Okay, scenario 2. Tom is a 45-year-old man who is a frequent patron at his local library. He can be found inside during the winter months, but is usually hanging out on the benches outside. Library staff notice that Tom is dressed in off-season clothes and is usually carrying 5 bags around with him that contain cans and other items. Tom also utilizes the bathroom to clean himself and wash his clothes. He has been living on the streets for 5 years. So again, let's think about what strengths you can identify that Tom has. Some questions that you might be wanting to ask Tom to get a better sense of his situation. And then what are some potential outcomes for Tom?
All right, we have someone say, maybe ask him where he's sleeping.
Yeah, that's a good one. For folks that are living on the street, that can mean anything from sleeping on a park bench to having, as I spoke of, one of my clients in the past, having a very elaborate tent set up, and kind of getting a location for that person can help you if you are filling that role of being a liaison between the patron and maybe an outreach worker. So that's a great one.
A strength that Tom has is that he's been able to navigate the streets and the library for taking care of his hygiene.
Yeah, absolutely. So his hygiene, even though he's been living on the streets for a really long time, 5 years, his hygiene is still important to him, and he's using his survival skills to make sure that he's clean.
Right. All right, let's go to our last scenario.
All right, so Ben is a 21-year-old patron at his local library and has been coming more regularly for the last few weeks since being kicked out of his house by his family after a dispute. He has been temporarily couch surfing with friends, but at times is forced to sleep in his car. He often comes to the library to use the internet and to hang out. While he usually is in the study room finishing his work, he has recently been searching for apartments in the surrounding area on the library computers. Staff have noticed a change in Ben's demeanor and the length of time he spends at the library.
All right, so some strengths for Ben is that he has digital literacy. He's able to navigate apartment searches. He knows how to use the computer. And some questions that we can ask Ben is simply if everything is okay, right? It just starts with a brief conversation. You don't have to ask specific questions. Yes, I completely agree. There's so much that you can get from someone just asking, are you okay? And then open it up and listen to what it is, how they respond to you.
Are you okay is a great open-ended question. If somebody responds with minimal information, you can always follow up with tell me more. Tell me more is another great prompt that's used in motivational interviewing to get a little bit more detail.
All right, do we have any more feedback about Ben? Another great strength for Ben is that he has friends, so he has a support system. And we can also ask him if he needs anything, if he needs to access any resources and try to assist him with that connection. Perfect. Thank you. All right, I don't see any other responses coming in. So that actually brings us to the end of our presentation. And we just want to open it up for any questions that you all have. So feel free to put them in the chat box. We also have our email address for myself as well as Diana in the event that you think of anything after this training. If you need any follow-up information, please feel free to email us. And if you have any other additional questions or any other training needs, you can also contact us at training@cceh.org. So I do have a few questions that came through, and I'm just going to read these. Are there resources for people who are not facing imminent homelessness to get help with finding affordable or subsidized housing? Sometimes they encounter people who don't know where to start. I would say for that, 211 is always a great starting place. It's not for individuals that are just experiencing homelessness. It is for anyone that is in need at all. They have services and supports and resources for individuals that are experiencing they need assistance with food or with clothes or substance abuse or mental health, any type of resources throughout the entire state of Connecticut you can access through 211. So I always say 211 is a great starting place for anyone that needs any type of assistance at all.
Yeah, I would add to that, Amber, too. They can give information on how to apply for public housing for Section 8 vouchers. So if you're looking for those applications and that process, 211 would be a great. The 211 website also has a screener tool that you can plug in your information and see what housing resources, what would be appropriate for you.
Okay. We have some information from people that are talking about our housing crisis, and that I will say that we will be having another training on November 16th. And in that training, we'll be going in more detail as far as how to really access the different resources, how to have these conversations in more detail, how to really practice it, and just having a conversation with you all as far as exploring the different policies that you have, different issues that you may encounter or problems that you may encounter. That training is going to be done in the Zoom setting. So it is more interactive. Being that this one was so much information, we really just wanted to provide a overview. So it is in webinar format. However, the second one will be in Zoom to allow for more interaction and more engagement. We do have a question that asks, what if someone gets offended or defensive? Should you back off and try again later? Diana, I'll let you handle that one.
I would say absolutely yes. Within all of those, best practices and techniques of being trauma informed, of being client centered, we really want to make sure that folks feel safe and respected. And so there are some de-escalation tools that you can use, as Amber said, addressing somebody by their first name if you know it, speaking in a soft voice. If somebody is causing a situation that has escalated to a safety concern, then certainly, that would be where you would need to, again, yes, back off, let the patron know that they need to leave the library until they've calmed down, but that they are welcome back to use the library, but also to communicate with you about their situation if they feel, that's something that they would like.
Also, I'll just add, before you go into asking those very specific questions, you may just want to wait, right, and try to establish some type of rapport with the individual first, so that you can kind of gauge how they may respond to your questions. You don't just want to start off initially asking if you have somewhere to stay. Maybe start with, how are you? Maybe the next day, how's your day going? So kind of ease into it a little bit instead of coming very straightforward, just to give you a little bit of time to build some type of rapport and engage with them. All right, we have a few questions. Is this session being recorded? Yes, it is being recorded, and it will be available to you all later. And can you send a link to register for session 2? I have it here, but I will put it in the chat box so you all can access that. All right. I don't see any other questions coming through. Ashley or Kimberly, do you all have anything to add before we close out?
Yeah, so basically we just want to say thank you all for coming. As you were able to tell, this was, yes, a lot of information, but a general overview. We all know from working in libraries that it's precarious, and it might be different depending on what region of the state you're working in, what department you're working in, reference versus CERC versus youth services. So our next workshop is going to be smaller. So we're going to be accepting less people because it is very purposefully engaging. So in the email that's going to go out after this with link and the survey, please do the survey. Y'all all know how the survey works. This is not new. We will be explaining that the next session will be asking that people who attend are able to have their camera on. People are able to unmute because there's going to be more here. A lot of this was very general, but we're going to be diving deep into specifics. So expect an email at some point once this video kind of downloads and processes and does all of that. And it's going to have the recording slides. I think the slides, the next registration link, and we'll possibly drop some information because we do have a list of cans attached to another presentation that we did. And reach out to Ashley or myself if you have any questions regarding this information from a state library perspective as well.
Great, and thank you so much for having us. We look forward to our next session. If you all have any follow-up or anything before our next session on November 16th, please feel free to email us. So thank you for having us, and you all take care. Thanks, bye-bye.
Thank you.